Good afternoon, parents. Once again, welcome. Thank you for joining us on a weekday afternoon, 3 p.m. It gives me great pleasure to welcome all of you to our webinar around the health and safety protocols that a preschool must take in this new normal. And I'm happy to welcome AK Srikanth, who will be joining us in a bit. So AK, as we call him, is the CEO of KLAY, and he is one of the biggest champions of health and safety at KLAY. In his previous avatar as the Chief Operating Officer of KLAY Schools, he has driven multiple health and safety measures. Some of the main ones being the infrastructural safety provisions like the Barton locks, the finger guards, and of course setting up the entire safety structure at KLAY, right from a safety officer at every center to the highest level of a chief safety officer. Yes, at KLAY we have a chief safety officer. So we always, we were always extremely paranoid about safety, right? So that you don't have to worry about our children left to us. So thanks to his efforts, thanks to the efforts of all the teams on the ground, we are happy to say that in the period between 2017-18 to 2019-20, our incident rates at the centers had gone down by 95%. Yes, so we were definitely a much safer place, and we are planning to make it even safer once you send your children back to school in June. So without much ado, I would like to hand the session over to KLAY, to AK. While AK would love to endlessly talk about safety, today's session is going to be particularly spent on talking about COVID-related safety measures, and we're going to try and answer some of the questions and queries that parents had raised with us in the survey response that we had sent to all of you. So I hope that you would find this 1 hour of time very useful. We will try to wrap up the session presentation in about 30-35 minutes so that we will have enough time to take up your questions. If anything that remains unanswered, we will definitely take it offline in case we run out of time. Over to you, AK.
Thank you, Divya. Thank you for your kind words. And good afternoon to all parents who've joined us. I see that some of you have joined us from London, so good morning to you. It's always a delight to be talking to the parents on a subject that's very close to our hearts. Health and safety has been a priority with us at all times. And of course, in times like this, it becomes even more paramount because our little ones depend on the safety of the premise that they go to. And you as parents and we as educators have to work hand in hand to make sure that they come back to a safe place. Now, given that the pandemic levels for the most part of the country are stabilizing, we're seeing that a lot of school sessions are opening up, primary sessions are opening up. Am I audible to everybody? There's some people, I think, for saying yes. I am audible, right? Okay. So there's a lot of opening up happening in India, and it's a matter of time before preschools also open up. And we thought this is a good time to be able to connect with all of you to let you know what we are doing, how we expect you to help us in what we're doing, and how collectively we can make it a safer place. Now, of course, we had sent out a survey to this effect a few weeks ago, and we received an overwhelming response from all of you. Many of you had raised a lot of questions in that on some procedural issues as to how we're going to tackle some of these issues. So we thought that the best way to address this would be to have a webinar where we could, answer some of the questions that were raised. Also take on some other questions that you might have. And of course, as Divya pointed out, if we run out of time, please feel free to reach out to any of us with your queries, or if you think of a question after the webinar, please feel free to reach out to us. We would be more than happy to address whatever concerns or queries or questions you might have. Now, before I begin on our presentation, there is a short video that encapsulates almost everything we're doing in about 4 minutes. It'll give you a flavor of how we're approaching it. And then I'll take you through the presentation in detail, following which we'll have questions. So if I may please request that the video be played. Thank you.
Hello, parents.
Thank you. Thank you for that. As you can see, we've covered quite a few points in the video, but now I think we'll take you through some detail of what we were talking about in the video. At the end of my presentation, as I mentioned, we'd be happy to take on questions related to the health and safety and our measures and what we could be doing to make sure that this place is completely safe, right? So let's start off with the presentation first without much ado. So Divya, may I request the presentation be put up, please? Thank you. Perfect. So as I was mentioning, at KLAY, health and safety has been our number one priority even before all this happened. Even before the pandemic happened, health and safety has always been one of our hallmarks. One of the reasons why we invested so much into this was so that the incidents and accidents which are avoidable. Now, I understand in a child's growing up years, there could be unavoidable accidents, there could be incidents, but we wanted to minimize it to the extent possible. We invested heavily into this. This health and safety campaign at our end is actually headed by a safety officer who's a NEBOSH qualified officer. NEBOSH is the highest, certification that a health and safety officer can get. It's a very, very prestigious accreditation, and our health and safety chief has that accreditation. So could we move to the first slide, please? Abhilash. Perfect. So I'll deal with this presentation in three parts. One concerns what we do with our center and staff. One is how we, take care of the child, and three is how the parents can help us. So beginning with the center and the staff, right? Obviously, there would be all our staff would have to go through an antigen test before reopening. All our premises before reopening would be fumigated, would be deep cleaned. Our washrooms and the common areas, we've got a protocol of cleaning them. We are doubling the amount of time that we are using in this course of day to be able to increase our cleaning of all these areas, right? All our staff temperatures are going to be monitored. It would be visible to you as well, because we enter it in the same student app, the parent app. All our staff, we're arranging to have protective gear and aprons available to them. Now, vaccination, if it is available for the general public, we will try and ensure that they are vaccinated. The only point here is that whether they throw it open at that stage or not is something we'll have to wait and see, because right now this is a prerogative of the government. Only yesterday they've announced that anybody over 60 and those over 45 with comorbidities can come up for vaccination. But I'm sure with time we'll have almost everybody available for vaccination. And at that point in time, we will see if all our staff can be vaccinated before they enter the class. But that depends on governmental directives on how the vaccination will be, administered. Now, within the center, we have very strict access policies. Obviously, we used a self-declaration form even in the days, if you remember, when COVID had just struck. We're going to follow that very strictly going forward. There would be a sanitization and mask policy across all our staff. And beyond the reception, entry would be strictly restricted, in the sense that we're trying to minimize the number of adults coming into the center, which is the whole objective of restricting entry at that point in time. Next slide, please. Coming to the second point, the safety of the child, right? Just as our staff has to go through a temperature check, we would need the child also to go through temperature check. This is important for all the other children who are coming there, plus our staff as well. So it's useful that we help each other maintain this, maintain the sanctity of these safety policies. Now, physical distancing rules, it would be our utmost endeavor to make sure that there are physical distancing. So we will mark out places where they can stand when in a queue, when they're washing hands, when they're being taken to the restrooms, within a class. Having said which, we're talking about children here, which is why I said to the best of our abilities, because children do have a tendency to break lines. We will try and enforce physical distancing to the extent possible. Of course, when they're sitting inside the class, the way we arrange the classroom would ensure there is physical distancing at all times, right? In order that we don't crowd them too much at the same time, meal times and activity times would be staggered. The pickup and drop-offs would also have to be staggered, so that we are, again, the whole objective of this is to not have too many people in an enclosed place at the same time. Parents and visitors, the entry is going to be strictly restricted. Parents would have to drop off their words at the reception area. During the functioning of the school, we will not take in any prospective parent for a center tour of any kind. Those would be done at times when the school is not working, as in the children are not at the school. So we do not want any kind of outsider to come inside. And even when the staff comes inside the schools, they will not be able to, as in other than the ones who are meant to take the class, the other kinds of staff would not enter the classrooms. They'll have to be let in there under the strict prerogative of the center director. So again, the objective is to keep this as low as possible. And of course, hand washing, it's been well proven that regular hand washing is extremely efficacious. In this particular case, we would make sure that hand washing is done as per a scheduled timeline throughout the day, both for our staff and for the children. Yeah. Now, from your side, how can you help us help you? So one is, please help us in maintaining temperature monitoring of yourself and the child, so that, when you load it up in the Care Community app, we are also able to see that this is being maintained, and we can then truthfully say and rightfully say that, we are monitoring everybody who's coming into the system. Now, in order for this to be successful, again, I would request you to please take this point extremely seriously for the sake of your child, for the sake of the staff in the center, and for the sake of all the other children in the center. It's imperative that we ensure temperature monitoring. Initially, at least till things stabilize, there will not be any cooking, because that obviously poses several risks. We would expect you to please send home cooked food for the child. If you could label the personal items, for the sake of convenience, that would be very helpful so that things don't get missed out. You would have to organize safe transport for the child. To begin with, we would not be able to have children use our transport because the transport is run by a third party, and we don't want to take the risk of having a public transport system ferry the children or our staff. So we would request you to please organize safe transport for the child. And most important of all, please support us in implementing these. I know that it can sometimes be a little tricky, but it's for the sake of all of us. It's for the sake of all the children who are coming to the campus. And therefore, your cooperation is imperative in making this successful. So it's my earnest request and the request of all our KLAY staff members to please bear with us when we put on these protocols. It's for the safety of everybody concerned. Now, given all this, what happens if there is an incident, right? Now, obviously, if the child or a staff is showing symptoms while there, when they came inside, everything was fine, but while there, they're showing symptoms. Now, in this case, we have identified sick rooms where we would isolate the child till parent arrival. We'll evaluate the situation for 3 days. And the reason we're saying evaluate the situation for 3 days is because these days when a child has flu, when a child has fever, or any one of us has fever, some kind of a medical thing, the doctors are saying you'll have to give it a period of 3 days to see how this condition is developing before you even recommend a COVID test. Because, when schools open, there is an anxiety level that exists in the child. There is, a sudden difference in the environment. They've been at home for the last year. So these could manifest themselves as fevers, which are not necessarily anything to be worried about, right? So we will evaluate the situation for 3 days. If the symptoms do not persist, of course, we'll deep clean the center, but we would be able to make sure that the child comes back. Now, if the child or the staff tests positive during this, in that case, the center, based on the number of cases, may have to be quarantined, depends on for how long. And there would have to be a home isolation, there'd have to be a COVID test, and there'll have to be a disinfection of the center itself based on pest control agencies' protocols. So it depends on what we find, whether the test is positive or negative. And of course, that we would know only after, right? Please move on. So how did we come across this? We've consulted multiple sources. Of course, we've taken public health institutes, such as the Center of Disease Controls. We've taken their guidelines. We've talked personally to several international schools. I've talked to my counterparts from other parts of the world and how they have dealt with the opening, and we've taken some best practices from them. Of course, the parents have given us many, many suggestions in this feedback form or even otherwise. We are incorporating those, and we're going with what pediatricians are saying about this. So in order to get an approach that is as safe as possible. Now, remember that, is it possible to be COVID-free? Obviously, no. If we could guarantee that, that our school is a COVID-free zone, I suspect the governments would want to know from us how we did that, but we could make the risk as minimal as possible. If we do these simple things, we don't have to do any very hi-fi things to do it, but if we follow some simple protocols, I think the safety levels that we can measure inside our schools would be very, very high. The chances of getting positive are very low if all of these are followed perfectly. Next slide, please. Now, you might say that, hey, we are dealing with preschoolers here. Now, regular school, that's a different story. Kids are grown up. They can take care of themselves here. They're babies. They don't always follow rules. They're excited about meeting their friends, social distancing, might go for a toss. Will they wear a mask at school? All these questions would be on your mind. Now, what we've done is taken recommendations from WHO and UNICEF. And what are they saying about this? Now, while we do insist the child comes wearing a mask, whether the child wants to wear the mask at the school or not is a discretion that's left to the parent and depends on how well trained the child is for wearing a mask. Now, I'm talking up to 4-year-olds. Over and above that age group, they would be able to wear a mask. But below 4 years, even WHO and UNICEF is saying that they should not be required to wear masks based on the safety and overall interest of the child. So these are opinions that are coming from sources, which are very reliable sources. And therefore, this is our recommendation. Because to be saying that the child would wear a mask at all times, I don't know how implementable that is given the age of these children. So we would implement rules that will help the child abide to the best of their ability. There would be misses in this. There would be chances that a child doesn't always sit in, social distancing protocol. They might run towards their friends. They might take their masks off. These have to be taken into account. To the best of our abilities, we'll try and control that, right? With preschoolers, this is a thing we have to accept. If they're coming back to school, there could be a risk that social distancing will not be maintained, at least at some times, right? Children are excited. They're excited to be back. They're excited to be with their friends. They're excited to be in their favorite environment. In such circumstances, they do, behave in their excitement of the child, and, social distancing can get compromised at that point in time. Next slide, please. Now, going by global findings, again, I'll continue on what WHO and UNICEF are saying. So the Journal of American Academy of Pediatrics actually confirms that childcare offers low-risk environments to children. Now, in this age and time, when I go out, I do see children coming up in malls. I see children coming out in restaurants, children coming out in public places. Now, compared to all of that, where the environment is such that the control is very low amount of control is possible, in a pediatric childcare facility, the control levels are much more predictable. And therefore, it is obvious that these are lower risk environments than many other environments that the child finds himself or herself in, right? Now, a Yale professor also did a survey with 57,000 childcare centers across the United States. He has also suggested that young children are less likely to transmit COVID-19 than are older children or adults. Now, this is something that has been backed by the number of cases coming through also. The spread rate seems to be much higher with regard to adults than it is with children. Now, you could debate back and say, hey, but we never let children less than 10 years out of the houses, so how do we know that? Only know that because that is what the professors and the educational institutes and the research institutes seem to confirm, right? So at some point in time when the children do start going out, and in the United States, children have been going to daycare for a while now. It hasn't been shut like we have been shut. They've found that the rate of spread is much lower amongst this age group than it is for adults or older children. Next slide, please. Here are a couple of examples of how certain countries dealt with it. And Denmark and Finland have been in the mess that Europe was in those heydays. Now, the surprising part is that they opened the schools up for the youngest children first, rather than the other way around. In India, we've been opening the high school, and then now we're up to middle school. We'd probably get to primary school and then to preschoolers. But in Denmark and Finland, it actually was the other way around. Now, two things that Denmark put together. One was, of course, the legal right to quality education, and that superseded everything else in terms of their decision making. Also, remember that they opened on April 15th, 2020, which at that point in time, the cases were really shooting up in Europe, right? So when families, one, they were asked to allow children to come back, and two, the government actually mandated remote learning for those who don't. So there was, both of these were happening in Denmark. Now in Finland, a similar story. Early childhood education, grades 1 to 5, all of these have been opened. The right to education outweighed the health risk of going back to school. The PM here did not allow remote education after reopening. So those children who wanted to stay at home actually required special permission. Now, Finland is a country with whom we've also recently tied up for our teacher training program. And therefore, we are in touch with a lot of preschool administrators in Finland, and the stories they have is very, very different from what we hear in South Asia. Next slide, please. So if you look at all global best practices, let's just go through it. Reduced number of hours, parents not allowed beyond a certain point, frequent hand washing, educational materials are sterilized, classes are divided so that the smaller groups possible, any child or parent who presents any kind of symptoms would not attend school or would not come to school. The community parks are reserved for children during school hours. Now that happens a lot more overseas. I don't know if that will happen here. Staggered student arrivals, no food sharing, no morning meetings held in class, no huddles. All of these have been generally the principles that have been followed the world over, right? And we are trying to take on as many of these into our school reopening considerations as possible, right? Now, while in those places globally, government promised to provide support for remote learning, in our case, we already have remote learning available through two of our programs, Care at Home and Learn at Home, and those would continue to be offered. In fact, offered also in a hybridized form. So if you want your child to gradually ease back into the system and don't want the child to miss out on curriculum, all of these can be combined, tweaked together, and put together so that the child doesn't miss out on anything, right? So in effect, we've thought out possibly the best way in which, at least in 2021, the child does not have to suffer for lack of education for that 1 year. Now, all of us worry about children not going to their 10th grade, their 12th grades, IIT exams coming, entrance exams coming. But the fact remains that this age group we are talking about, by missing 1 year of their education, and considering researchers have spoken about the importance of the first 2000 hours of a child's life and how education shapes that period of life more than any other age is influenced, I think by losing out on that right now, we have lost a lot. We have made up for it as far as possible with online, as far as possible with teacher at home. I'm hoping that if the cases stabilize and we're able to come back, that would be the best thing. Maybe a hybridized model to begin with. Maybe it'll go on to become school as usual as we go on, right? So on that note, I think, having gone through the videos, having heard me out for this many minutes, I think it's time that we started addressing some of your concerns, questions. Please do note that in case we are unable to come up with an answer right now, we would get back to you as soon as we can and address your question. But we'll try to take as many questions as possible and try to be as transparent with you as possible about everything, only because it's only as a partnership that this can work out. It's not something like we've sent the child there, now it's your responsibility. It's our responsibility. You as parents and we as educators have to come together to make sure our children are safe. There's no third way about it. And we will make it work, just as other countries have made it work. So on that note, I open it up for questions. Divya, if you could please read them out to me, I will try and answer them to the best of my ability.
Sure, Ricky. Thank you for the presentation. Very informative indeed. And anybody who wasn't able to hear the audio or wasn't able to hear the video of the, wasn't able to see the video that we played, we will send all of this to you along with the safety brochure, which encapsulates all the information that AKLAY presented to you. Before I start with the questions, we just, request all parents to mark all panelists when you are writing out the questions. In case, we're not able to answer, we make sure all panelists at least respond on chat to you, once the webinar is done. Okay, we have a lot of questions coming in, so we'll start with the first.
Sure.
Will the daycare center open for infants who are 6 months plus, or is this opening only for toddlers?
The answer to that actually lies with what the Ministry of Women and Child Affairs decides, right? Because infants as a program comes under the purview of Women and Child Affairs. Now, if they put up an age limit that you can open preschool from 2 years onwards or something like that, then infants would get precluded. Our plan is to open the entire age group. Now, we will go by what the government has to say before we can answer that. And I'm in touch with the government officials. I will keep the parent group closely informed as I hear of any developments on this.
The center is closed, will the classes be held online?
Yes, we will be continuing online classes in addition to having centers open even when they open up. So once the centers are open, we do not expect the online format to go away. The online will continue. Not just that, even our teacher at home program will continue. So you are able to make the decision in the best possible way. You could have some amount of online and some amount of school. You could have some amount of teacher at home and some amount of school. You could hybridize all three and you could ease your child back into the system. Everything that we are providing now shall be continuing in the future, even when schools open.
What about admission formalities in case of reopening, whether we have to go for new admissions or transfer?
There would be a complete communication from our teams about the admission processes. In fact, strangely enough, Divya and I were the ones who were in the meeting that finalized this a couple of days ago. So early next week, I think we'll release a communication on how exactly to go about the admission formalities, and that should be able to answer all your questions on admissions.
In case the centers will open in June 2021, what will be the time the center would be open for?
As of now, again, that is something that the government is likely to tell us, that you can't be open for more than 4 hours, you can't be having more than 50% of your students at a time. I suspect all of these would be handed down as government mandates. Now, from our side, I think whether the government says it or not, I think what we are planning to do is have 50% occupancy at any given point in time and gradually ease it back as the pandemic eases, as the vaccination is thorough, right? Now, what time to what time we'll open the center obviously would depend on governmental guidelines, of course, but if we are planning to have 50% of the children at any time, we might have to run it in 2 shifts, which means that the center would be available all day. It's just that how many hours can a child be there depends on how many children do we have in the premises. And we're going to be very careful about how many children can be there at one time. So it completely depends on the demand for the services. Of course, as more and more of our schools open up, see, there would be a staggered opening. It's not like on June 1st, if the government says, yes, all our schools might not open. It depends on the demand. So based on our demand, we'll open up more and more of our centers. And therefore, as we see the numbers are inching up, as we see parents are very comfortable about sending their children back, we'll try to open up more and more centers and for more and more time. So all of this will be communicated to the parents probably closer to the opening time, also based on governmental inputs.
Okay. What are the regional epidemiological factors that are taken into consideration prior to opening a specific center safely?
Regional epidemiological conditions, I'd need some elaboration on that. I'm afraid I'm not the doctor, so some of these terms are alien to me.
I think it's referring to the cases in and around the center and, possibly the what is the kind of spread that we are looking in a particular locality, and depending on that, would our opening considerations vary?
Very, very valid question. Actually, one point that was not covered in the PowerPoint, but I'd like to mention now is that all our parents and all our staff members would be carrying the Arogya Setu app. Now, if it says that they are from a zone that is red, then obviously entry is not allowed. Even our staff members would not be allowed if they're from a red zone. If the school itself is in a red zone, then the school will not open.
How often does staff testing take place?
Right now, for our Care at Home program, I think we do it once in 2 weeks, is the current protocol that we're following. I think when schools are opening, we'll definitely take the test at the same frequency, once in 2 weeks, and that's our tie-up. I'd like to hear from the parents if they are comfortable with that, if they're expecting something more or less. I'll leave the question open. If parents want it every week, we could consider that. However, if they're inoculated, then I suspect this whole question goes away.
Interesting question. How will you be able to identify the COVID symptoms in less than 4-year-old kids? Because it is tough for them to explicitly mention that they have lost their sense of taste or smell, or if at all they are having headaches.
Very true. Very, very true. What will happen, however, with such a child is other symptoms, right? When children can't express exactly what they're saying, the very fact that the child becomes less active, the child, even otherwise, before the pandemic, when a child is less, active, more withdrawn, we sense that something is wrong with the child, or perhaps he or she is coming down with something, even if the temperature at that point doesn't detect anything. Obviously, our teachers and caregivers have done a lot of such cases where they see one particular child is not really active, aloof, withdrawn, irritable. Typically, we suspect that something is going down the wrong way for the health of the child. So if we get symptoms which are not explicit, like temperatures, like headaches, we do get other signs that the child says, and our teachers and caregivers are well read to understand those. And obviously that would play a big part in identifying if the child is unwell. I think the bigger problem is if the child is completely asymptomatic and yet a carrier, right? Now that we may have no way of knowing. And that is a genuine fact.
So, Ricky, there are a lot of questions around reopening. When would we reopen? Is it going to be only daycare or preschool? So just maybe you would want to just answer all of them so that I won't take any more of those questions after this.
Right. I think reopening, I know for a fact that some preschools and some daycares have actually opened up in other areas. However, let me caution that the government has not yet issued any directive to preschools or daycares to open up. We will open up daycares and preschools at the time we are expressly allowed by the Ministry of Women and Child Affairs or by the Ministry of Education to allow us to open. Right now, the central government has let it on the state governments to decide. So we will be waiting for the state governments to send out a notification that it's okay to open now. Now, judging by the way things are, I think is safe to assume that schooling will probably open with the next academic year, which is June, in most cases, July in case of NCR. Daycare, however, also has a component. It depends on how many parents start going back to work full time. So it also has a bearing on, if both parents have started working, if tech parks have started to open up, if companies have, sort of said that, okay, work from home is no longer an option and you've got to come back, and that starts increasing, then the daycare might start earlier. So it's really a function of a lot of things.
In school, I understand that safety protocols will be put in place. Those who show symptoms can be identified, but how do you plan to stop those who are asymptomatic from entering the school?
Exactly. So let's be frank. If children are completely asymptomatic, as in if they have no temperature, if they have no other symptoms, if all their family members seem to be fine, I would not have a way of identifying that child, and that is a risk we'll have to live with. I think that is as much a risk we live with even today. You go to a gas station, you go to a mall, you go to a restaurant, we have no idea if the people there are actually asymptomatic and carrying, or are they really COVID-free? Because those that are symptom-free, it's almost impossible to figure it out, whether they are actually COVID-free or not. The one thing we can take solace at is the fact that children don't appear to be very high-risk carriers or spreaders of the disease. And I think that is what we'll keep in mind, that, even if they are asymptomatic, they're less likely to spread it as opposed to adults.
Is it compulsory to send the kid once the preschool opens, or can we as parents decide to continue online classes?
You definitely can continue online classes. As I said, we'll open up the admission formalities in a couple of days. It will give you the options to continue online, continue care at home, come to the school, or merge one or two of the above based on your convenience, your comfort levels. You send the child to our school when you're comfortable with the fact that children can go back to school. There's absolutely nothing from our side that says that, no, 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 you have to. Absolutely not. We will continue online learning. I would suggest gradually start reintroducing this into the child's life rather than, plonk him into it at one go.
Regarding parents will not be allowed into the classrooms. This will make it difficult for children to get accustomed to the new environment. Previously, on day one of the parents used to be inside with the child. How will that policy change now?
This policy was our policy. Settling children need to have parents come inside the classroom and be there. Now, this year, owing to the safety of the child, we would not be able to do that for obvious reasons. It's very difficult for us to control that many people inside the environment. You're welcome to sit and watch from the, on the video displays near the CD cabin. That is fine. But this particular year, the ground rules of settling parents have changed. It's unsafe not just for your child to have other parents come inside, it's unsafe for every child there. And compared to the risk of settling versus the risk of infection, I think I'll take the risk of settling. So we will make sure that our teachers, our caregivers, our center directors are that much more attentive and that much more, helpful about helping settle the child in very quickly. But in the face of having a risk of children getting infected by adults coming in there, I think I would go with child safety. The only exception to that would, of course, be mothers who are feeding their children. We would let them in to some extent, and there are specific areas in the school where we let them in. So that will continue. That shall not be stopped.
Now, since second wave seems like knocking around, how prepared are we to open the daycare?
If the second wave knocks around, we will not open the daycare. And I'm hoping it's not knocking, it just goes away because nobody's answering. But come to think of it, I think the places like it's Maharashtra and Kerala that have been mostly impacted by this. I think the other states are showing signs of, if not declining, at least maintaining a lower rate of infection. However, if there's something like a second wave, I suspect the government would reverse. Even if they have given us the permission to open, they'd reverse that decision. So the government in India has been extra careful. As I pointed out, Denmark and Finland actually opened up preschool at a time when pandemics were raging through Europe. We have been closed for a year because the government thought it was unsafe to put our children to risk, right? And that was the policy we followed. If there's a second wave, there's no question of us opening. It will remain shut. But online will continue.
Temperature will be monitored for the child and their family. Sorry. Yeah, temperature will be monitored for the child and their family, and in case of any symptoms, they will be asked to stay at home for 14 days. Can family members of staff also be checked for temperature?
Yes, they can. It's a good suggestion. I think we should. I think that is a part of the protocol anyways. That child, the immediate members of the staff who are in close proximity should be monitored. Please take note of that. My other colleagues who are on the call, I think that's an excellent suggestion. If we aren't doing it already, we should.
We are gathering the information in the declaration form, but we could also put it as a part of the temperature monitoring.
Yes, I think we need to see, I would like to see temperature monitoring charts for their significant others and for the others in the family, if they're living in the same house, that is, of course.
There's a lot of questions about online classes. We answered that. Our offices might ask us to work only for 3 days a week, and most of the centers are located in office premises. How will this be handled?
So while offices are likely to say come 3 days a week, what I also understand is offices are likely to break up the employees into two parts. You come these 3 days, the other one comes these 3 days, right? So the daycare could actually operate as long as we have a limit of how many children can be in the daycare at that time. So I think if it comes to that and daycares are open, I think that's how daycares will address the problem. So while the staff is going there at half its strength, the daycare would also be functioning according to that, but 6 days a week. because there would be another set of colleagues or other companies over there. See, tech parks are also likely to come up with a section that says that, okay, this wing opens today and that wing opens on Tuesday, Thursday, Saturday, or there could be all those combinations happening. So the daycare would be present, it would be open, albeit at a peak. We'll fix the peak that it can never go beyond this, at least till the vaccination kicks in full and proper. And I think the vaccination, see, just like the COVID testing in the beginning was done at select hospitals. And now I think a COVID test can be ordered at home, if I'm not wrong, right? So at some point in time, the vaccination system might become open for all, where they may say you could go to any clinic and get yourself vaccinated. This is a list of clinics or something like that. And at that point in time, we could actually make sure that everybody in the system is vaccinated, whether it be parents, they have to come with a proof, whether it's our staff, they have to come with proof, right? And once we reach that stage, I think things are fine. Until that stage, we'll have to limit the number of entries into the school. It's for our safety.
I paid for admission before I joined her. There was a lockdown. Now I'm shifting to a new location. Can I transfer my kids' admission to the new state?
Yes, absolutely. Yes, you can. Please get in touch with our regional heads and they will help you do it.
Most of the parents are working from home away from their office locations. Can we be flexible in choosing any location where we live than our base location?
So are we talking corporate parents or are we talking standard parents?
Yeah, I think until now, since they're going to be at home, can they be choosing locations around?
I think we'll be as flexible as possible. So if they can choose a location, as long as we've not hit a peak capacity for that location, I have no problems. Now, if that location they choose is already running at peak capacity, then we'll have to look for alternatives again. It completely depends on whichever center you choose, to what degree has that got filled out, right? So if we have restrictions that we're not going to go above this number, and if that number is already reached, then we have a problem. Otherwise, we'd be happy to accommodate your child, no problem. But the sooner you let us know about where your child might be wanting to come, the better it is, so that we can, make arrangements for that.
All centers will be opening, or is it going to be location specific?
I think we'll first start with location specifics and then gradually move on so we think that all our centers will open over a 3-month period between June, July, and August, right? Assuming that everything goes well and June 1st, we are able to open, then I expect that between June and August, which is in a 3-month period, all our system will come to life. So it'll begin with probably 1/3 of our schools opening to begin with.
My daughter comes to KLAY as after schooler. Is this discussion equally applicable to daycare, especially for time and duration? Considering that KLAY would open their centers before formal schools open up, is there any specific program available for this age group of 5 to 10?
After school daycare as a program would be available anyways at our schools, right? Now, another exciting development that we're working on is an after school online program, which we're working on. It's called the KLAY Enrich, details of which will be available with you very shortly. So again, if you want to keep your child engaged without the child having to go out to school to have those activities every day, then KLAY Enrich is a way to do it, where you could again merge online and offline offerings in a way that it maximizes. So we're thinking up of more and more ways of engaging the children, whether it be online or offline or in social bubbles. And we'll keep coming back to you with these. So KLAY Enrich is something we should be, I think, ready for launch by the first week of April. Am I okay with saying that, Divya? Would that sound like a reasonable timeline? The reason I'm pushing it back to Divya is because she's been working very hard on that project herself. So she probably knows the opening date as much better than I do. So yeah.
How would the fee structure differ if we were to choose a hybrid structure of classes? Because we are still paying for online classes the same to pay for classes at school. In essence, are we going to have to pay twice the amount?
No. You're not going to have to pay twice the amount. You'll pay pro rata amount. And the details of which will be with you very shortly. You won't have to pay twice the amount because you're taking partly school, partly online. It doesn't mean I'll charge you online and school. It's a holistic solution I'm offering you, so it would be charged accordingly.
Home food might turn cold and the child won't be interested in eating. How do we solve for that?
Big problem. I know children can be very fussy about that, but unfortunately, opening up our kitchens at this stage is something I don't want to risk. So if you have a way of getting, I mean, if you live close to the child's school, if someone could bring over the, dabba in the afternoon and give it so that it's fresh, that could be a solution. But opening up our kitchen at the moment, I think is a risk we don't want to take. There are too many elements of risk that come into a kitchen. We've got enough in our hands with children and staff coming already. So we'll add these elements one by one as we get more comfortable with the stability that the pandemic is on its way out. That's when the kitchen will come back. That's when the transport will come back. So at the moment, I think those are risks we don't want to take. We'll have to find an alternative for that. So maybe for some time, it may be a problem for you, just a short time. Hopefully all this will be a thing of the past very soon.
The next one is not a question, but an interesting comment. Well, I would say all the best to teachers, as the nature of kids might have changed during the pandemic. So thank you, parent, for that. We are bracing ourselves to settle all our children.
Yes, but I do assure you that the nature of our teachers is still the same, and they are longing to see their children back. I can't even begin to tell you how many of them have written to us saying, "Sir, when are you opening your schools back? We want our children back." They haven't been asking about furloughs. They haven't been asking about reduced pays. They've been asking about when do we get to see our children. So I think the children will very quickly see that, their beloved teachers and caregivers are waiting for them in a way that they can't even describe. So I think that should be fine. We'll take care of them.
If my daughter is in corporate program and I'm working from home, can I send her to nearby non-corporate center without additional charges? We did address.
Yes, it depends on what your company's policy on this is. If your company is willing to accept that, I'm sure we can accommodate them. So we'll need an email from your authorized representative in the company saying that it's okay by them, and we'd be happy to accommodate them.
Can you please share the priority centers which might be opening soon for preschool or LKG?
Yes, we will be putting up our priority centers very shortly, probably in a space of a week or 10 days. I think at least we'll have a tentative list of the centers which we plan to open in the first month, and then in the second month, and then in the third month, right? So in the first month, which we are planning to open, the regional business heads would be able to throw light on that probably in a week to 10 days time from now.
Could the fee be quarterly or monthly, as we may switch between online and offline classes?
We'll work that out. I think the fee structure is what we need to be. I think at the current moment, I want our children back and I want our children safe. Rest of it we'll discuss. We'll work out something that's suitable for you and for us. So that by itself is something we can work out. I think what is more important here is how are we going to manage? Now, fees normally are quarterly, just to answer that question. If you're switching between programs or if you're hybridizing programs, we'll have a way of calculating the fees, which we'll let you know when the admissions process is revealed to you in a couple of days. And we'll try to work ourselves in a way which is suitable to your needs as far as possible. Yeah.
Would the timing be the same pre-lockdown or would it be reduced?
The number of hours that your child can stay in the center might actually be dictated by governmental norms. I'm not sure about that, but in case of middle schools and high schools, they did put time limits on how many hours the child can stay in the school, right? I'm not sure in case of a daycare, how can they pull that off? From our side, we're willing to keep the centers open as long as the number of children at any time doesn't exceed a certain number, right? So as long as the government does not put any conditions on us, I don't think we'll have a problem with that.
In line with that, will the class strength be same as before?
No, it would be reduced because you see, even before pandemic, what we used to attempt was a ratio of about 45 square feet per child. Now, the global index is at about 30, 35 square feet per child. In fact, the government of India mandates 10 square feet per child. However, we will not open on that. We will open at a probably much reduced class size so that social distancing is something we can manage. If we have all the kids inside, managing social distancing actually would be a problem for us.
How how the children will cope up with the change from online to offline and directly goes to school, since they have seen this and during pandemic have been learning through online classes?
It's a very good question, and I think that is something we are also preparing for. So it would be what I would recommend is make best use of the hybridized model so that you wean the child off online and start sending him to offline classes for some days of the week and keep increasing that over weeks, right? Rather than directly pull the plug on online and start going to offline. I think the way you should do it is try to gradually get the child to attend school rather than just do it overnight one fine day. That would be helpful for the child because it gives the child that much time to acclimatize herself to both environments. That would be my suggestion on this.
What if we start daycare classes and if we have to shut down the centers again, then we'll be back to the online class mode?
Yes, if we have to shut down the classes, online classes are available. Care at Home, which is the teacher at home program, would also be available until the time that school starts again. You could use one of these facilities to continue the education.
Are you planning to vaccinate the teachers and supporting staff? You answered this, but I think
yes, if vaccinations become available to all, I would definitely be far more comfortable to see all of us vaccinated, including the staff, including the parents. But that completely depends on what stage of vaccination the government is at yet. As I said some time back, I think they've asked 60 plus to get vaccinated now, 45 plus if they have comorbidities. I suspect that that age, that'll come down to 50 plus and then it'll be opened up to all. And we're still talking about May, June. So by that time, maybe vaccinations would actually be a possibility for everybody. If it is, then we'll definitely try and ensure that everybody is vaccinated. But we'll have to wait and see how that plays itself out.
Will there be an increase in number of DDs per class?
No, we're not reducing or increasing the staff ratio at the moment. I think our DDs are well equipped to handle the number of children. And remember, our class size itself is going to be smaller to begin with. So while there won't be too many DDs in the class because having too many adults is not a good thing at the moment, we also won't keep it at a level where they're understaffed. I think what our ratios were before we closed down is the same ratio we'll be engaging with now, because that is the best way to manage that class without adding too many, adults into the class.
Thanks for the session. Impressive to see the efforts being put up till preschool fully opens up. Will teacher at home continue till then?
In fact, it will continue after that as well. We are planning to roll out teacher at home programs across the country, even in places which don't have KLAY school perhaps in the future. Definitely to address social bubble models as long as people are not yet completely comfortable sending back children, or there are threats of health which are weighing high in the parents' mind. Not only will it continue till then, we hope that it'll continue as a program for years to come. I think the KLAY curriculum should be in places where we are not currently present. It should go to a Baroda, it should go to a Lucknow, a Kanpur, a Bareilly. It should go everywhere. Now, I can't build schools in these locations for reasons of P&L interest. However, if I'm able to address social bubbles in these places, I would love to have the KLAY curriculum reach these places. So it definitely will live on.
When will we likely have a clarity on a definite starting date? What do you think the government is saying?
I think we should have clarity sometime by the end of March, first week of April, based on my conversations with the government authorities. This is, of course, I put one big caveat in this, and that caveat is that assuming everything remains status quo. If we find some caseloads going up in that city where you're talking from, then the government does, go back on that because it's completely dependent. It's a function of what the caseload is. If things continue as they are continuing today, I think by April, we should have a definite answer to this. I expect it by April, and that's what it looks like from what I'm hearing from the government authorities. I'm staying close to, closely tuned to this. I'll let you know as soon as I hear something concrete.
Will the preferences be given to the centers which are in office campuses?
What do you mean preferences?
Like, would we which are located inside office campuses, would we be giving them more priority in terms of?
No, I think the priority is based on how many of you want to come back to our school. So the priority would be given to those centers where I see the most demand. If obviously the demand is nil or very low in some centers, I might have to not open that center. But if the demand is high in any center, be that a commercial center, be that a residential center, it completely depends on what the demand looks like over there. If it looks like many children are going to be benefited by opening there, we'd rather open there. So it's not based on our comfort level, it's actually based on the community's comfort level of what they want.
Iki, we're almost at 4:03. Maybe another couple of more questions and then
Sure. Yes, please.
Will the staff wear masks at all the times?
Yes, they will. The staff will always wear masks.
What will be the approach for deciding the eligibility of the children to take up K1 or K2, etc., as they have had a break for a year?
I think we're also pushing for a child readiness course. Divya, I know that we'll be announcing details of that very shortly. Please, or we have already, right? So
I think this in terms of what class would they be eligible for, or how would we decide whether they're ready to take that class because they've had a learning break possibly?
that's okay. So we will get them ready for their respective class based on their age, and we are offering refresher courses for that so that they're able to cope up rather than feel overwhelmed by it. The idea would be to have them in an age appropriate class. That would be the idea, definitely.
What are the recommendations for parents who are staying away from the city? Any COVID tests recommended?
Staying away from the city.
I'm assuming in case they are planning to come back, travel back. In fact, I'm not too sure of.
Not unless, see, the government has some regulations right now in Karnataka about people coming in from Maharashtra or Kerala. If there's a governmental regulation like that, of course. If you're feeling like you have the symptoms which have persisted for more than 3 days and doesn't look like it's getting any better, of course. But if everything looks fine, I don't think the location of your current being matters for a COVID test. I think if you're feeling okay and things look fine, I just think wear your mask and come back to your city. We're looking for you. So please come back.
And the last question, will CCTVs be available as before?
Yes, they would. CCTVs would be available on the place.
I guess that's about it, Iki. There were a few questions around, whether we will share like an FAQ or, the recording of the session. Yes, we will do all of that. We will share a recording of the session as a YouTube link that you can watch later in case you missed portions of it. We will also share the list of questions that came up, some sort of an FAQs of what typically seem to be the, parent questions and clarifications. We will also share the safety brochure, which would, in essence, elaborate all the points that AK presented on his slides, and of course the video that we shared. All of this would come to you for your reference at any point in time. So I think the questions are done. Okay, any closing remarks? We can otherwise close the session.
Sure. So to all the parents on this call, I'm so grateful that you were able to make time for us and come online. Although I know it's a weekday afternoon, it's very reassuring that all of you are joining hands with us and giving us an opportunity to present to you what we are doing. We're open to all